Hi, everybody. Welcome to our program today. This is David Nevins for Citybiz List, and thank you so much for joining us. Our guest today is Dr. Adrienne Burgess, and her title is both impressive and a mouthful. Dr. Burgess is the Director of Perinatal and Neonatal Quality and Safety for the Maryland Patient Safety Center. Dr. Burgess, thank you so much for joining us today.
Thanks for having me, David.
So, Doctor, let's just begin. Tell us a little bit about your background and how you got to the Maryland Patient Safety Center.
Sure. First, I'm a nurse by background. I've been a nurse for 25 years in a variety of areas of maternal child health. Most recently, I worked at a large health system in South Central Pennsylvania, where I was the director of quality improvement for several service lines, including women's and children's. I got my PhD in 2016, which really started my interest in maternal child health, quality, and safety, and really kind of worked my way to find this great position at the Maryland Patient Safety Center, and started there in September as the director of perinatal and neonatal quality and patient safety.
Well, terrific, and welcome to the Maryland Patient Safety Center as a relative newbie. For those of our viewers who are not familiar with the Maryland Patient Safety Center, take a quick minute and tell us about what they do.
Sure. So as an organization, our mission is really to keep Maryland healthcare safe. And our goal as an organization is to really achieve zero preventable harm, engaging providers, nurses, and a variety of healthcare teams from in the hospital to community settings in providing compassionate, safe, and respectful care for all of Maryland.
Good. So, Dr. Burgess, I read about this every now and then in the newspaper, or you hear about it watching the news. It strikes me as remarkable that the United States is not necessarily the best and safest place for maternal health. Tell us why maternal health is such a major challenge in this country and in Maryland in particular.
Well, that's a really big question, David, but I'll do my best. It's actually quite sad that, as one of the largest and richest countries in the world, that we do so poorly in maternal health, and we can't seem to get better. Year over year, the United States is one of the worst in outcomes for maternal health in all industrialized countries. And, I think on a positive, we're starting to really take note of that. As you said, you hear about it in the news. Why that's happening, I think there's a multitude of factors. I think resource allocation, focus from hospitals and community organizations on providing access to quality care to all women, not just women with the most resources and the most money and the most funds and ability to get to those resources. So I think we just, as a society, need to focus more efforts towards ensuring that all women have access to equal resources throughout the continuum of pregnancy care. So from the prenatal period to, intrapartum, to the postpartum, and then that time period that I think a lot of people forget about in between. It's not just good enough to ensure that women have access to equitable care during their pregnancy, but we need to make sure that they're healthy all the time. And so, women often, access care during their pregnancy, but in between they're taking care of their families, and, it's not as much of a focus on their own health. So I think that it's important for us not to just focus also on prenatal care, but ensuring women have access to the care they need all the time.
And I know that's a big piece of the work that you're doing. And I know also that this problem is particularly acute among Maryland's minority population. I would imagine among the nation's minority population. Tell us a little bit why that is so, and maybe address some of the hurdles in overcoming this?
Yeah, recent data actually was just released by the CDC last Friday, and it showed that unfortunately over COVID, there was a significant impact on maternal mortality data, and there was a significant rise in maternal deaths, even over the poor maternal health data that we already had and the rise that we were seeing. And the disparities in this continue. Black non-Hispanic women die at almost 3 times the rate than do non-Hispanic white women. And I think that the reasons for that are varied, but we must, really address the fact that there are, one, access issues, and 2, the impact of implicit bias and racism on the care that these patients receive. And so the Maryland Patient Safety Center is one of many organizations in the state that's working to address this issue. One of the programs that we have developed is called Birth Equity Maryland. Birth Equity Maryland is a program aimed at non-obstetric providers. So that might sound unusual when we're talking about maternal mortality to focus on non-obstetric providers, but with an understanding that approximately 53% of maternal deaths occur in the postpartum period, it's important to really make sure that healthcare providers, not just in the obstetric area, are aware of this problem and work to, recognize the signs and symptoms of obstetrical complications and ensure that these patients get resources. So Birth Equity Maryland is focused on emergency department providers in particular, but also primary care providers and those in community settings. But we're trying to target providers across the state in emergency departments and provide them with some education on the impact of implicit bias on the care they provide to birthing people across the state, as well as provide them with education on how to recognize obstetric complications and make sure that patients that present for care receive education on these warning signs so that they can present back if necessary. We've also really tried to develop some patient education resources so that patients can advocate for themselves and really, push forward when they feel concerned or uncomfortable or unsafe with the care that they're receiving, and really are working with those emergency department teams to develop communication skills so that they can communicate within their own teams when patients present for care.
Well, I think we're certainly lucky to have you here in Maryland, and we're lucky to have the Maryland Patient Safety Center. I know you have another program you wanted to talk about. I can guess what this might be, but I'll let you, as the expert, count the kicks.
Yeah, Count the
Tell
Kicks.
us about that.
I'm really excited to talk about Count the Kicks as well. That is a new program that actually we are launching in April. It is a collaboration with an organization called Healthy Birthday. Unfortunately, in addition to there being significant disparities and increasing rates of maternal mortality, we're also seeing increasing rates of stillbirth, as well as disparities in that in that outcome, unfortunately. So one of the ways that we can help to hopefully identify babies that might be having some type of challenge or need some increased surveillance is through counting kicks. So this is a program that we are rolling out to providers, nurses, any birth worker across the state who engages with pregnant parents, to really teach them how to teach parents about counting kicks. It may sound really simple, and it is actually really simple, just to track your baby's movements, track it to determine if the baby is moving differently than it usually does, so that you can bring that to your provider and advocate for some further surveillance or just evaluation, so that you can determine if there's anything going on. So the program is evidence-based. It was rolled out in Iowa, I think about 10 years ago, and Iowa saw a significant decline in their stillbirth rate after implementing this. So we're hoping we can get statewide implementation and engage all the birth workers throughout the state in the program, so we can spread this to expectant parents across the state.
And I guess, Dr. Burgess, I guess that's essentially your job, right? And part of the the good news here is that, at least in Maryland, we have one of the nation's most vibrant healthcare ecosystems that you have the opportunity to work with. So I know you've been in your job about 6 months, I think you said. So how's it going? And when do you think we'll have evidence of improved conditions?
So how's it going? I think it's going great. I've been very excited to get to work with perinatal and neonatal providers across the state. I've been trying to get out and meet folks at the hospitals and engage with different community organizations. If you don't know any perinatal or neonatal professionals, they're very passionate about around their specialty. So they're great to engage with. They are very excited about the resources that the Maryland Patient Safety Center has been developing. Outside of these two programs, we've been really working to focus our efforts on this area and supporting perinatal and neonatal professionals in developing just their quality and safety programs at their facilities. So they've been super engaged, which I'm excited about, because I hope that if anyone's out there and is listening, I hope that you reach out and will, check in with the Maryland Patient Safety Center. We want to develop resources for your teams to help support the work across the state. In terms of when will we see differences in outcomes, obtaining data on things like maternal mortality and stillbirths, the data coming in, it's slow, right? We are looking at cases from probably about 1 or 2 years behind. Typically, when the CDC reports data or the state evaluates data, we're looking at cases from about 2 years. So there's a data lag. I think what we're going to have to really lean into is, one, looking at process and structure measures, understanding our teams really implementing these projects the way we've intended, and asking hospitals and health systems to evaluate the data themselves internally, looking at their own numbers. That's not data that I necessarily have access to, but as we're working to implement these projects, that's what we're going to be working with these teams to do, helping them to evaluate their own work internally. So it's going to be hard. It's going to be a little bit before we see the outcomes at a state level, but I'm hopeful through standardized implementation, we'll see those outcomes improve.
Terrific. And let me just ask you, in the moment or two we have left, what excites you the most? I think you're probably pretty enthusiastic and excited about a lot of things.
You may have noticed that, right?
Yeah, I have, and good for you, as you should be. But your work at the Maryland Patient Safety Centers is terrific. But what excites you the most about the future and the opportunity to impact in a positive way, our much needed improvements in maternal health in Maryland?
Well, David, that's exactly the reason I came to this position. I would say throughout my career, I started out as a bedside nurse in labor and delivery, and did that. I taught childbirth classes, and in labor and delivery, you have the opportunity to impact the patients that you care for one family at a time, which is really really important. And then as I moved to childbirth education, I had the opportunity to talk with families, and that, took you to the next step. And then as I grew my career, I worked as a nurse faculty and I thought, wow, that's really exciting. You get to impact nursing students, and they're going to go out there and care for a variety of patients and really be able to impact their care. And then I moved to a health system, and I got to work in a health system. And this position allows me the opportunity to work with a whole state. And I feel like I came here because the Maryland Patient Safety Center, really the opportunity to be able to develop resources around perinatal quality and safety, and the opportunity to be able to engage with every hospital and health system in the state and the community organizations that impact parents is tremendous. And I think that this is something that's much needed, that didn't really exist in one location for these hospitals and health systems. So I feel like there's endless possibility, knowing that there's so much work to do in all of these areas, that if we can all just come together as, one group and work towards this common goal, I really think that we have the potential to improve outcomes for moms and babies in Maryland.
I hope we can count on that. And Dr. Burgess, how does one reach out to you, contact you, and learn more about your work at the Maryland Patient Safety Center?
Yeah, that'd be great. So we have a website. Also, we have tons of socials. I'm not sure if maybe you can help and throw those socials up there for us. But you can follow us on LinkedIn, Maryland Patient Safety Center on LinkedIn, on Instagram, on Facebook, all of those, as well as check out our website. We have a whole section on perinatal and neonatal resources, as well as a variety of others. So you can find my contact information there, as well as how to register for any of our events that are upcoming.
Well, we will do that as well. Dr. Burgess, thank you so much for your time today.
Thank you.
Our pleasure. This is David Nevins for Citybiz List, and our guest has been Dr. Adrienne Burgess, Director of Perinatal and Neonatal Quality and Safety for the Maryland Patient Safety Center. Thank you for joining us, Dr. Burgess, and thank you for watching.